Good morning, Joe Roble, once again back with Dr. Robert Newhalfen of Northwest Indiana Chiropractic. Good morning, Dr. Bob.
Morning, Joe.
Dr. Newhalfen today is going to be talking to us a little bit about pediatric evaluations and how to evaluate movements. Why don't you go ahead and tell us a little bit about your philosophies and a little bit about pediatric evaluations?
Well, Joe, about 30% of kids won't develop ideally. And, that's research across many different, that's well-known research, about 30%. And what that means is not that the child has cerebral palsy necessarily. Obviously, those kids are in that 30%, but it's that your child, it's not that they can't crawl or squat or walk, but that they don't do it well. And the fact is the kids in that 30% tend to later on in life have scoliosis, chronic low back pain, chronic neck pain, hip issues. So those are the kids who later on in life will tend to have more significant and more chronic issues. And so it's really, really important to get more than just height and weight evaluated for a kid. Height and weight is a small part of development. What's a much larger part is how the baby's moving. That actually has a lot to do also with brain development. And so you can use cerebral palsy kids as an example is, they have part of their brain that isn't working quite right. And then they don't move right. So their development movement-wise is delayed. And so there's a direct correlation between brain development and good quality movement. And so what I assess in kids is, if you could see the poster behind me, at 3 months, a baby should be able to lift their head up off the table, and they should be able to lift their feet up in the air like this. And so if a baby is not doing this right, they might put a little too much arch or lordosis in their back. And so then moving forward, without proper training or proper exercise, they're going to continue to have that hyperlordosis as they develop. And then their spine is literally going to develop like that. And so I just can't tell you how important it is. It's not just, is your baby moving? It's how well is your baby moving?
Well, it's interesting. It kind of almost seems too like anything else, catching bad habits early and, being a former athlete and coaching kids, it's you teach them the right way to do things physically, kind of, corresponds mentally, and you kind of get that muscle memory as well as mental memory. So that's interesting because you're right. I've never heard of actually, doctors really don't evaluate movement. It's always height and weight, and having 3 kids, it's always like, oh, well, what percentile do they fit in? And they don't really talk too much about, they might do a hearing test and maybe some eye tests, but that's very interesting.
Yep, there's, obviously a lot more to development than just height and weight. There's function. And what we're finding out is that the way a baby functions can later then dictate the structure of their joints and the way that their body is actually formed. And it's really common in certain populations to have different kinds of hips. Well, that's typically a result of the baby not learning how to crawl correctly. And so, which later on, then their hip forms a specific way, which puts specifically like females at risk for ACL tears. And so a lot of that stuff can be minimized or possibly even prevented if you take a look at the baby at a young enough age. So I recommend evaluations every 3 months for the first year. So typically in the first month, at 3 months, between 5 and 6 months, at 9 months and 12 months, and then every year after that, because it's not too late to start changing that stuff, and it's also never too early. The earlier you can tell if a baby's going to have problems, the quicker often and easier it is to fix. And a lot of this isn't me doing the therapy, it's me teaching you, the parent, how to do the therapy at home, because you're the one spending the majority of time with the baby. And so where I come in is finding what is wrong and looking for that quality of movement. And once again, parents, 70% of kids do develop normally. It's that 30% that we really need to catch, and we need to catch it early.
Well, it's still a high percentage. So,
yeah.
Well, thanks, Dr. Bob, for enlightening us. And if you have any questions, concerns, want to bring your baby in, or just not quite sure, give Dr. Bob a call. He's at 219-322-6942. or visit his website at nwichiropractic.com. Thanks again, Dr. Bob.
Thanks, Joe. And for all you parents out there, please, please, please get your child evaluated the earliest possible that you can.
There you have it.